Wonderful. All right. So, welcome everyone again. This is one of our Be Well talks that take place. And so today's topic, I think it's going to be very exciting, and I do hope you enjoy it as well. Paula comes from a background of many different things, and we're very excited to have Paula with us today. So, just to make sure you are in the right place, our webinar today is on narrative medicine and writing prescriptions for integrated care. So Paula, welcome. Thank you so much for being here with us today. So a little bit about Paula before we do dive into the talk. Paula, if I could have you, perfect. The next slide. So Paula is an anthropologist, consultant, writer, and caregiver. And so Paula currently is finishing her advanced certificate in narrative-based medicine at the University of Toronto and is interested in illness narratives, solidarity storytelling, and health equity, especially in the oncology space. She is also an advocate for autistic cancer patients and has developed a guide to help support their cancer experiences. She is also a member of AllCan, Canada's knowledge mobilization and evidence working groups. So Paula, thanks so much for being here today with us, and I'll pass it over to you for our presentation today.
Thank you so much for having me. Everyone can hear me okay? Great.
Yeah, all good.
Good, thank you. So again, thank you. You've actually said everything I was going to say. So this is narrative medicine, writing prescriptions for integrated cancer care. Good afternoon. So my name is Paula. I'm an anthropologist. I'm a writer. I'm a practitioner of narrative medicine. And I was also the caregiver for my sister who recently passed away from ovarian cancer. And she was also autistic, which is how I got into this work. I'm an advocate. I'm a researcher for autistic cancer patients and for others who are marginalized and underserved communities in the oncology space. As an anthropologist, my original doctoral and postdoctoral work was actually in the American Southwest with Indigenous women, looking at, among other topics, pilgrimage and medical narratives and post-colonial Indigenous identities. And I'm currently finishing up my studies in narrative medicine at the University of Toronto, where I'm interested in cancer narratives, which we're going to talk a bit about today, health equity, and what I call solidarity storytelling. And I'm joining you today from Vancouver Island, the traditional unceded territory of the Comox First Nation. So this is a talk. It's kind of the elevator pitch, an introduction to some of the principles of narrative medicine, and more specifically, how we might conceptualize, write about, and relay a cancer experience in other than biomedical ways. It's also a preview of the upcoming 4 sessions that I'll be offering through Wellspring this fall that focus on expressive writing using poems and prompts, one of my favorite practices of narrative medicine. And you'll get a trial of this expressive writing yourself later in the second part of this session. So please have a paper and pen ready if you can, or pencil. You can also use an electronic device, but I like a pencil because there's no delete button on this, and it helps with our creativeness. So if you can, if you want to participate towards the end of the session, that'd be great. So what is narrative medicine? Very briefly, narrative medicine is really quite simply the understanding that we as human beings are storied creatures. We're storied creatures. We're wired for stories. So we live with stories, we die with stories, and we each experience illness in a storied way. Now, narrative medicine began with the work of Dr. Rita Sharon from Columbia University. Now, Dr. Sharon is a physician and a literary scholar, and she first used the term narrative medicine back in the year 2000 to describe what she called narrative competence. Narrative competence. Now, narrative competence for her was the capacity to recognize, to absorb, metabolize, interpret, and be moved by stories of illness. Now, mostly this referred to the healthcare provider's capacity to do all these things, to recognize, absorb, metabolize, interpret, and be moved by stories of illness. And it began as a way to compensate for the overly clinical, biomedical, and reductive treatment of patients. But narrative medicine, more broadly, looks at this recognizing, metabolizing, and interpreting and being moved to action. That's that equity and advocacy piece. They move to action by stories of illness from all perspectives, not only the healthcare providers, but also that of the people experiencing illness themselves and the caregivers, all the people on the stage. So basically, the better we are at getting good with stories, getting comfortable, getting familiar with, for our purposes, cancer stories, their themes, their characters, their kind of narrative arcs, their plots, their backstories, their stages. And I don't mean stages like stage one, stage two. I mean like stages like theater. The better experiences and maybe even the better outcomes we will all have as patients, providers, and caregivers. But how? How do we get better with stories? That's the question. How do we learn to recognize, metabolize, absorb, and do all those things we're supposed to do with stories? So we begin with some principles and some practice. So narrative medicine begins with the principles of attention, representation, and affiliation. So attention, representation, and affiliation. So attention here means this really careful reading of, listening to, attending to the story and not just the symptoms. Okay, attending to the story and a commitment to the situation as it presents itself, as it actually presents itself. Representation, these things are kind of, logical when we think about them. Concerns how patients are written about or spoken about to four groups of people. To within medical colleagues, so this is provider to provider, medical colleagues, to the patients themselves, how your provider is speaking to you, to the patient's families, and also how the clinicians speak about the patients to themselves. That's the representation part. And the last part is affiliation. This is that commitment to standing beside, to bearing witness. This is a way to deepen empathy and compassion in relationship with patients, but also with fellow clinicians. So together, attention, representation, and affiliation have this kind of natural bent toward advocacy. When you start to listen to the stories, you start to care about the story. Narrative medicine values personhood, that people-centered care we hear a lot about, that patient-centered care, reflexivity, reciprocity, creativity, and action toward justice, and explores how all of this can, should, does, or does not show up in the healthcare space. So narrative medicine is inherently whole person work. It cares about the rest of the story. It's inherently patient-centered. It's a way to understand and express the experience of cancer beyond test results, chemo schedules, treatment plans, prognosis, diagnosis, beyond tumors and little lumps of rogue cells, because we all know that cancer is so much more than that. Narrative medicine sees value in bearing witness, in unfixing, in indeterminacy, in the kind of isness of everything. All of those sort of icky, touchy-feely things that traditional modern medicine sometimes shies away from. So again, how do we get better with stories? Well, we are encouraged to explore themes. Okay, we're looking at some of these themes. And this is a way to recognize and interpret a story. But as I hope to show briefly, this kind of isn't just this sort of cerebral literary exercise just for fun. Give me your cancer story and I will interpret the themes there, because that's sort of a little bit cruel and colonial in its thought. But it's a way of getting good with stories, because cancer stories matter. We know this. We know this intuitively. If you're showing up for this, you know this. They have origins. They have consequences to care. So how people understand their own cancer experience matters. And again, getting better at looking for things like themes, characters, backstories, back theater staging allows us to provide more sensitive and more integrated care. So briefly, some of these cancer thematic explorations can include a restitution narrative. a chaos narrative, or a quest narrative. And I borrow and adapt these from sociologist Arthur Frank. So, a restitution narrative. This is going to sound familiar to some of you, maybe. This is focused on the anticipation of getting well. This is very cure, technology of cure focus. So, in this story, cancer is this brief aberrance, as if you're ticking along. Here's your story. Cancer is a detour, and you're going to return to normal soon. So, this is a kind of we're fighting, we're winning, we're battling, we're focusing on the cure. This kind of battle talk is very deeply embedded in our mass cancer conversations. Again, just a caveat here. There is no right or wrong cancer narrative, obviously. They're each individual and unique to all of us. There's no one way to be or not to be. They just kind of are. This is the isness, the indeterminacy of it all. So, in this understanding, cancer is this brief aberrance and return to normal is coming soon. So, with this person experiencing cancer, if this is their understanding of their cancer, what happens when they don't return to normal? What happens, for example, when recurrence happens? This is a biomedical challenge, for sure. It's a biomedical challenge, but it's also a biographical challenge. It's an identity challenge, and it's a narrative challenge. Another example would be like a chaos cancer narrative. In the chaos understanding in this story, it's a big old mess. There's no meaning, there's no redeeming insights, there's no respite, and there's no reason. There's no rhyme nor reason to any of this. This is my cancer story in this understanding. This may be how the patient is experiencing it. And knowing this for the provider and knowing this for the caregiver can actually, again, help provide that more sensitive care. Think here how this patient may or may not accept certain treatments if this is their understanding of cancer. How can the caregiver help? How can the provider help here? And then the third one, just briefly to look at, is a quest cancer narrative. This is the understanding that there are insights to be found, there are lessons to be learned in cancer. This is this understanding. This is the I got cancer for a reason. God gave me cancer for a reason. We often have external factors happening in this story. So in this story, cancer is the role of a transformer. Okay, a way for the person experiencing cancer to become someone new. So how might this narrative drive treatment decisions, provision of care? So there are subsets and crossbreeds of all of these. Now, each person might experience, well, will experience a different kind of narrative or different ones at a different part of a singular cancer experience. For example, a person might get diagnosed and they might say, okay, I have a restitution narrative. I'm going to circle back to normal. I'm going to get better. I'm going to fight. I'm going to battle. I'm going to win. Okay, good. That rolls for you for a while. And then maybe recurrence happens. And then it's a chaos narrative. And then maybe as end of life approaches, we're going to have that that understanding in which there are lessons to be learned. There are, so there again, there's no right and there's no wrong narrative. They're value neutral, but self-insight for the person experiencing cancer, as well as their providers and their care providers, their unpaid and their paid care providers, can support more integrated and more sensitive cancer care. So in addition to exploring themes, we can think about cancer kind of as a theater, right? Not a surgical theater, but a theater, like going to the theater. We can look at backstories, pre-stories, and the stage on which that cancer experience is set, as well as the other characters that are happening. And what lines do they have? What lines are they given? What lines do they demand? All of this matters when we're looking at access to care, treatments offered, treatments chosen, as well, therefore, as outcomes. So let's consider backstories or pre-stories for a moment. So these are particularly important when it comes to equity and advocacy work. We can move beyond what are the social determinants of health, very important, to what are the backstories or pre-stories for any cancer narrative. For example, What is the patient's previous experience with the healthcare system? Before cancer comes to town, think of it as a theater. Before cancer walks on that stage, that person has probably had an experience with the healthcare system. They already have a story with the healthcare system. What if this person is autistic, as my sister was? Sensory processing, communication issues, history of medical mistrust. What if we have a trans person, a newcomer, First Nation, Inuit, Métis? How might that all affect the cancer story before it even begins? Let's get better with those stories, care about those stories, and we can get better with care. And what about the providers' pre-stories? They have them. That's a giveaway. Now, these can show up, or they can work really hard to eradicate them, but they do have them and they do bring them to every healthcare encounter. These can show up as biases, prejudgments, slash interpretations, and misinterpretations. Again, either positive or negative. They're not all negative, not all positive. So healthcare providers, we know they aren't robots, nor should they be. We don't want them to be. And even despite the best training, or even with best training, they bring their stories to every healthcare encounter. I met an autistic person once. They were like this. They were like that. I met a trans person once. I met a person from this community or that country or look like that. And so they've already got stories happening before you've even opened your mouth as a patient and before we're even talking treatment plans and what happened on your charts and your scans. Again, how do all of these prejudgments, racism, ableism, homophobia, transphobia, all of these things, how do they affect a person's care? When we think about them in terms of storytelling, there's actually a way in. There's a lens in there. So all of these, or the really hard work to eradicate these, can color an oncology provider's story and thus color every healthcare encounter. And let's talk a little bit more of that theater, that stage, that backdrop on which the cancer story takes place. Think here about challenges for rural or remote patients, not enough financial or family resources. What if travel is too expensive, too far? What if there's no one to help with care of children or elderly? What if time off work is not a possibility? What if there is no paid employment? How might these affect options of choices of treatment? What might be offered? What might be accepted or refused? And why? Why? The answer is usually in a story. The answer is usually in a story. Again, I encourage you not to see the things that I just listed, as a list of unimportant social facts that belong sort of off the medical chart, kind of over here, off stage somewhere, or even the list of sociocultural predeterminants of health. They are the latter, absolutely, but only as starting points. They evoke whole and unique narratives in every single situation. And who are the other characters in this cancer narrative? What roles do they play? This is crucial in access to care, care at home, and the process of decision making and consent, particularly when that is challenged, and thus often to outcome. So, in my mind, it's not just what are the stories, but why? Why are the stories? And that's how we get better with care. So, cancer is always set in a physical and social geography and timeline of the other than cancer self. This is the other than cancer self. And cancer is always set in that timeline and that geography. So we might have this English-speaking white heterosexual male of economic means he has this history of rapid response and expectation from the healthcare system. Or we have our autistic person, history of medical mistrust. Maybe we have an abusive situation at home. We have a trans person thrust into the pink feminized world of breast cancer, and he does not identify with that, even though that was his assigned sex at birth. All of these things are entire complex stories that affect the outcome of the care. So stories matter to these people prior to cancer coming to town, and they matter and color the entire cancer experience. And providers and caregivers are equally storied people. So narrative medicine, again, encourages us to move beyond what are the stories. That's the recognize, absorb, metabolize, interpret part to the why are the stories. And that's the be moved to action part. Get better with stories, then get better with care. And all of this extra, and as you can tell, I don't think any of this stuff is actually extra non biomedical information, can be said to create a kind of parallel chart, or what I call the rest of the story. And when I think about a medical chart, anybody's medical chart, it's quite spinal, it's fleshless, it's lifeless, it's certainly unanimated. The full complement of characters, stage set, overarching themes, the behind, the before, and the after the scenes work, the story work, tells the true happening of a cancer experience. So, one way to get better with stories, to start to care about the stories, is to encourage expressive writing, which then taps into that creativity, that indeterminacy, and can also reveal barriers to care and individual and community based senses of health and ill health. This is magic that works, frankly, in my opinion, for people experiencing cancer, as well as those for providing both paid and unpaid care. But why, or rather, why bother? As people ask, why do I prescribe expressive writing for all of the characters on the stage, for patients, for providers, and for caregivers? Why do I prescribe this? Well, because cancer fractures. Cancer fractures a person's life. What was before? What comes next? What comes after? Fractures. Writing can help redraw maps, can help us remember, can help put us things back together, knit memories, knit new ideas together, make new connections, and find new destinations. Writing can address the existential qualities like hope, despair, inner hurt, faith, the loss of faith, which can accompany cancer. Writing is a way of reflecting on cancer that reveals so much more than just a recitation of your medical charts and your test results and your diagnosis and your prognosis and when's your next scan, when's your next blood work. And trust me, if I ask you about your cancer, you're probably going to tell me all those things, right? But there's more to the story. It allows us to fill in that parallel chart. So when we write through the lens of cancer, through the time of cancer, whether it's as a patient, a provider, or a caregiver, it can help express the joy, grief, the uncertainty, the hope, the transformative, whatever it is that we're feeling, all those feels. And it can cultivate presence, compassion, and support well-being. Words, either our own or others, or reflecting on others, can be kind of like the best medicine and go right to the site of a need and meet it. So writing and responding to prompts and poetry, which is what we're going to do in my 4 sessions, and we'll do a little bit later, can be therapeutic acts, not therapy, but therapeutic acts, because it exteriorizes the illness experience. It gets it out of your body and out of your thinky parts and through your creative parts. It communalizes, it shares suffering and addresses isolation. This is what I call the me too, but in a good way. The me too, or I never thought of it that way, kind of parts of writing or even writing together in a brief community, as we'll do in our sessions. Writing is a way for us to bear witness, to stand outside and stand beside, to honor all of the changes that cancer brings, the physical changes, psychic, familial, spiritual, emotional, all of the changes. And writing can help us remap new landscapes, can help us remember ourselves, and integrate the sometimes fragmented and fragmenting experiences of cancer. And writing about cancer gives us a voice at a time which might feel kind of silenced or silencing. And we'll talk about the writing field in just a minute. Wrong way. Sorry. There we go. So there we go. Sorry about the slides there. So my favorite thing to do is actually getting people out of that Birth comes, then comes, this comes kind of way of writing about cancer. Although that is a really worthy thing to do. And if that's something that really rings true for you, in the beginning was this, then I had my diagnosis, or I didn't get my diagnosis, and then I did this and this and this and this, that's fine. If that's how that works for you, great. But I kind of love to drop people in these sort of deeply resonant, brief communities of writers where they can explore through poems and prompts these anti-linear moments, these vignettes or flashbacks or experiences. This is very process oriented, not product oriented. This isn't how to write good stuff. It's very process oriented. It's highly accessible and it's encouraging for anybody with like no level of writing experience or someone's a little iffy on their writing abilities. And it can be done by somebody who frankly isn't feeling very well or in small doses in between seeing patients or as a micro dose of self-care as you care for somebody else who is unwell. So we're going to look at a poem that might evoke some moments in a cancer experience, although the poem itself is not specifically about cancer. I tend to not use cancer poetry because it's a little, in my mind, sledgehammery, if that's a word, a little kind of over the head, right? So we have evocations. Evocations, is that the word? We use poetry and prompt and quick timed writing experiences, like 3 minutes, go, turn your brain off, pen on, go, as a way to inspire reflections, remembrances, and for the opportunities to be kind of like a window, a mirror, a portal, just an entry into that whole big mess of a cancer situation that you might be going through. So when we write in the shadow of a poem or in the light of poetry, we sit with the words of others to inspire us. We're looking for resonance. That's what we're looking for, is resonance. We're asked about the way that words might needle us, might poke us, might prod us, might take our breath away, might give us some breath. Poetry can do that, and writing can do that. So the point, again, to circle back to that last slide of why bother to write when I have cancer, is because writing feels. Writing feels in a way that other things may not feel for you right now. It might feel good, bad, scary, freeing, encouraging, safe, risky. It might feel a whole bunch of things, but writing feels. And that is the point. And it's the experience of writing, kind of testing it out. It's kind of testing it out as a therapeutic tool and focusing on the product and not focusing on the process and not the product. And that's the magic. And that's kind of the medicine. And the reason we use poems is because they are acrobatic. They're playful, they have a rhythm, they have a weirdness, they have an unexpectedness, and they can comfort us in their starkness and their beauty and their strangeness sometimes. And when we look at things like hope and loss and grief and all of those things through the lens of a poem, there's literally more space on the page. And sometimes there's more space in our thought processes to understand all of that. So there's more room for exploration, there's more room for reflection, and there's more room for companionship. You want to try? I know you do. So we are going to look at Hurricane by Mary Oliver. And then we're going to have a quick 3-minute write. So this is a great time to get that paper and pencil or open something on your phone and we can do this. So before we do this, I have a few minutes, a few words about safety and courage for writing. Or there might be some of you who are like, me, poetry, no thanks, I'm out. Click off, I'm out. You can do this. It's hard, it's fun, and it's illuminating and it's worthwhile. And I have rules for you. They are impossible rules. But they're really essential and they're rules I still struggle with. Briefly, they are this, and in our sessions, we spend more time on these. 1, don't think. Turn those big, beautiful brains of yours off. Don't think. For 3 minutes, you'll be fine. Keep your hand moving. Even if you're writing, I have nothing to say about this, and this is really dumb, and I don't know why I'm doing this exercise. By the end of the 3 minutes, you will have written something pretty fantastic. Trust me. 3, don't censor yourself. Be open to what arises for you. Again, you're not sharing this, so we're not focused on something. This is not a school essay for you. 4, you are free to write the worst crap possible. Do not consider it as crap. It is compost. It is compost, to grow something fantastic. 5, you do not have to share. I hope that you will share. And in our brief community of writers, we'll be sharing a lot, but you don't have to share. Because if I told you you'd have to share, you're going to break rules 1 through 4, right? I would for sure. And you are free to write in the language of your heart and in the manner that you are in the manner of your heart. So if you want to write a rap, a haiku, a poem, the opening 1 act play, please do. Or if you want to write poetry or prose or words or journal entry, do that. And it is enough. What you have written is enough. You can revisit it, you can rewrite it if and when you wish. But for now, the process and the experience of writing is enough. Okay, I'm going to invite you to close your eyes, take a breath, and we're going to listen to Hurricane, and then we're going to have a 3-minute write on the other side and look at some prompts. And this is a very fast version of what one might do. Okay, so Hurricane by Mary Oliver. It didn't behave like anything you had ever imagined. The wind tore at the trees, the rain fell for days, slant and hard, the back of the hand to everything. I watched the leaves bow and their leaves fall and crawl back into the earth, as though that was that. This was one hurricane I lived through. The other one was of a different sort and lasted longer. Then I felt my own leaves giving up and falling, the back of the hand to everything. But listen now to what happened to the actual trees. Toward the end of that summer, they pushed new leaves from their stubbed limbs. It was the wrong season, yes, but they couldn't stop. They looked like telephone poles and didn't care. And after the leaves came blossoms. For some things, there are no wrong seasons, which is what I dream of for me. In the interest of time, we are going to move directly to the prompts, but in our sessions, we will have a lot more time exploring that poem. So if you would like to write for about 3 minutes to one of these prompts, it didn't behave like anything you'd ever imagined. Maybe as a patient, as a caregiver, as a provider. This is one hurricane I lived through. For some things, there are no wrong seasons, or the back of the hand to everything. And we're just going to write for a few minutes. This will just give you a brief little, tiny little taste of the writing medicine. And then we will have time for either talking about the writing, talking about the poem, or I'm happy to answer any of your questions on the other side as well. So please take a few minutes and if you wish to write to one of these prompts to Hurricane, and I will see you on the other side in just a few minutes. And I invite you to draw your thoughts to a close. And again, in our sessions, we'd have much more time for writing. So I encourage you to join me in the upcoming sessions next month for a more in-depth way of how this kind of narrative medicine and expressive writing can support people experiencing cancer, and those of us who love them and who are trying to help them. And we'll be looking at a number of interrelated themes and writing in the light and the shadow of poetry at a much more slower and relaxed pace, as well as creating a brief community of writers and brief poems every time. So thank you so much for joining me today, and I'm happy to open the floor to questions. Thank you so much.